The United States was vastly unprepared for the COVID-19 pandemic, and the CDC wants to make sure that doesn't happen again. To that end, the agency is giving Northeastern University $17.5 million to create a center for spotting and stopping the next outbreak. Called Epistorm, the center will lead a group of 10 research institutions, healthcare systems, and private companies to monitor and predict when viruses will surge and hopefully give healthcare systems time to prepare. I'm joined now by the head of the new center, Alesandro Vespignani, who also directs Northeastern's Network Science Institute. Alesandro, thank you so much for joining me.
Thank you for having me.
So you've predicted, this is what you do, you predict these pandemics, and I wonder what can we immediately expect, in the immediate future? What are we kind of looking at in terms of the waves of COVID or perhaps something else?
Well, we are approaching the winter season. The winter season is when respiratory viruses generally tend to be an issue for the healthcare system. They add to the burden in the hospital. So we have COVID, but we have also RSV, we have influenza. And so it's important to try to have a way to look into what happens in the next few weeks in order to provide the intelligence to the people fighting diseases in hospitals, the healthcare workers, the medical doctors, what they should expect. And this is what this center is about, to generate intelligence that is actionable and can be used to fight better diseases, not just pandemic, but many other infectious disease threats.
I understand this is what you'll be working on at the center, but what can we take from the way that the country handled the COVID-19 pandemic and continues to as a lesson for the future?
I think, not just this country, but the world was in a way unprepared to something, to an event like of the proportion of the pandemic of COVID-19. From 2019, and then we fast forward to nowadays, a lot of improvement to our surveillance systems, our capacity to anticipate the move of the virus, to gather data has been done. It's incredible what all all hands on deck that has been that happened in the past years. Now it's the time to operationalize that, to be, how to say, more prepared, to not invent the wheel during a crisis, but to be prepared in standby for that crisis so that we can have better information as quick as possible. This is what we really want to do. We want to know weeks in advance what we should do and what is the level of the threats. And for doing that, we need to build something that is like, a national weather forecast center that is able to project the path of the major storms and tell people what to expect. We need to do that and be in that position in the next years.
I understand that we've already learned a lot from the research that's been done on COVID in terms of RNA technology and other things as well that we can apply to other diseases and cures.
Yeah, well, can we, for instance, project how many cases will come from other countries in case of an outbreak that is not in the United States? This is something that we want to know, and we experience also in the past years, not just with COVID, but with Ebola in West Africa, with other diseases. So we need to be ready for something that is not necessarily in our country. We need to be prepared to threats that could come from many other different places. We need to be ready also to manage what is the some diseases that are regular, like influenza. We don't have to forget that influenza is straining the healthcare system every year. So there are, how we say, pathogens and viruses are always one step ahead. And we want to have better technologies, better intelligence to fight them better and earlier.
So we only have about a minute left, but I wanted to ask you, we already have a new variant of COVID. It isn't as deadly, but it is deadly for many people. Should people, in preparation of the winter season, should people be masking and social distancing? And is there going to be another booster? Should people panic?
No, people shouldn't panic. We are not going back to the 2019. We are in a different, what we say, epidemiological landscape. So the things are very different. But it's very important that, especially for fragile people, for seniors people, to get boosted. There is now a new booster that helps. It's important that the population gets this vaccine as well as the flu vaccine. And, the winter season is always a problem. And the more we are vaccinated and the more we are, especially if we are fragile, if we are at risk, are careful, and the better it is. So, it's not the moment to panic, but to follow the recommendations that are coming from health agencies and the CDC.
Great. Alesandro Vespignani, thank you so much for joining us. Thanks for your time.
Thank you very much.